For those who are new to the Health Law Policy and Ethics Seminar Series, I'm Trudeau Lemmens. I'm a professor at the Faculty of Law in the Dalla Lana School of Public Health here at the University of Toronto. I welcome you as chair for this session on disability inclusion and the pandemic. I want to acknowledge first that the land from which I'm speaking and in which we are privileged, particularly in those challenging times, to live relatively peacefully together, has for thousands of years been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous people, as we all know, from across Turtle Island. We're grateful to live and work on this land, and hopefully we'll all contribute to greater respect and acknowledgement of the moral obligations we have towards this land and Indigenous people, which certainly includes persons with disabilities in the Indigenous community. So, and on that note, I'm very happy to have today two presenters and two commentators. Deborah Steenstra and Valérie Grandmaison will talk first about their report under the title Consistently Excluded, a Disability Inclusion Analysis of Canada's COVID-19 Policies. And that will be followed by a commentary by Gabrielle Peters and Sarah Jama. So very briefly, to introduce the speakers, Deborah Steenstra holds the Jarislowsky Chair in Families and Work at the University of Guelph, where she's the director of the Life Work Well Research Center, and she's also a professor of political science. She's the author of About Canada, Disability Rights, published in 2020, and her research and publications explore the intersection of disabilities, gender, childhood, and Indigenousness, identifying barriers to, as well, possibilities for engagement and for transformative change. Valérie Grandmaison is a PhD candidate in the Department of Sociology and Anthropology at the University of Guelph and a research assistant at the same Life Work Well Research Center. Her research focuses on how diverse women with disabilities survive, thrive, and resist the multiple and intersecting structures that shape their lives. She's particularly interested in the relationship between gender-based violence and structural violence, activism and justice in the lives of diverse women with disabilities in Canada and transnationally. Then we will have Gabrielle Peters, who is a disabled writer and policy analyst and a commissioner on the Vancouver City Planning Commission. She's co-founder of Dignity Denied and the Disability Filibuster, and has been a leading voice in applying a disability lens to local, provincial, and national policy issues. Gabrielle's work often focuses on further developing the radical theory of accessibility by integrating lessons of disability justice, harm reduction, trauma-informed practice, and grassroots community development and transformative change activism. She was the lead author of several reports, and her writing on disability has been published in Maclean's magazine, CBC, and other publications. Then last but not least, we have Sarah Jama, who is a community organizer from Hamilton. She is co-founder of the Disability Justice Network of Ontario, and holds a social sciences degree from McMaster University and a lead organizer certificate from the Center for Labor Research and Education from Berkeley. Her lived experiences have fostered interest and a passion for community engagement, disability justice, and activism, and she currently works at the Hamilton Center for Civic Inclusion as a program coordinator. So there's more to be said about all of the four, but let me welcome our speakers to start with their presentation now.
Thank you, Trudeau, and thanks for having us. You should be able to see my screen. I'm Deborah, and Valerie's going to start, and we're going to go between us. So Valerie, go ahead. Oops. I'm not very good at screen share stuff, so, or at least, yeah.
Perfect. Hello, this is Valérie. So we first want to acknowledge that Deborah and I, we live and we work in Guelph on the treaty lands of the Mississaugas of the Credit and the Dish with One Spoon Wampum. We understand the significance of the Dish with One Spoon covenant that we nurture through relationships with our Anishinaabe, Haudenosaunee, and Métis neighbors, as well as our relationship with the land and with future generations. So to begin, we are really grateful to have this opportunity to share with you a project that we conducted in the fall of 2020 and early 2021, which explored the impacts of COVID-19 government measures on diverse Canadians with disability. The project was funded by Economic and Social Development Canada, and it's available online. We can post a link in the chat in a second. So today we're going to explain a little bit our approaches that we took in the study, namely an intersectional disability and gender framework for policy analysis. We're going to present findings according to 2 thematic themes and conclude with 5 key messages, 5 key takeaways from this research project that can inform more intersectional advocacy, policy implementation, and social change. Just to begin, we'll give a little context of the study.
Valerie, you got to tell me when you're changing slides.
Okay, coordination. Yeah, so I guess next slide. Yes, the context of the study. So decades of disability-related research across the world suggest that people with disabilities experience greater effects in situations of risk than non-disabled people. The United Nations Convention on the Rights of People with Disabilities, which we call the CRPD, calls for the protection and safety of people with disabilities in situations of risk, such as the COVID-19 pandemic. Canada has ratified the CRPD in 2010. Despite these commitments, the pandemic has disproportionately affected people with disabilities in Canada, not only in the risk of contracting the virus, but also through a range of negative impacts, reduced access, and intensified systemic inequities resulting from policies in response to the pandemic. So we know that from crowdsourced data and community surveys, these sources have revealed some of the barriers and discrimination that people with disabilities face at different stages of the pandemic. These impacts include loss of employment, loss of education, loss of social supports, decreased access to care, decreased access to safe, affordable, and accessible housing, and increased mortality. These effects have been profound for people with disabilities, their families, and their support and care providers, yet largely invisible to those outside of the disability community.
So we wanted to give you a little insight into the tools that we use to analyze the data that we gathered during the study. So we used an intersectional disability inclusive policy analysis. So as probably you all know, intersectionality, although coined by Kimberly Crenshaw, is a concept that's been at the heart of much of Black feminist thought for decades. And Indigenous feminists also note the similarities between longstanding Indigenous approaches and intersectionality. In this project and in other Live, Work, Well Research Center projects, our community engaged research teams have taken up policy-related research that implements intersectional research methods. We do this because we have a deep commitment to demonstrating and seeking to transform unequal power relationships, including for, by, and with people with disabilities. So we approach intersectionality as an analytic tool and as a practice for social change. This helps us to understand better the accumulating and cascading impacts of the pandemic on diverse people with disabilities and identify areas for policy change. Intersectionality, we believe, adds to and enhances critical policy analysis. Olana Hankivsky and Julia Jordan-Zachary suggest that it encourages us to explore how systems and structures of power are mutually interdependent and interlocking, how they change and evolve over time, and how they take different shapes and meanings depending on the geographical, political, or economic settings. Intersectionality involves analysis at multiple levels, linking individual experiences to broader social structures and institutions. And it requires us as those who are using it to identify our own locations in these power relationships and be reflexive when we take on our analysis. Finally, intersectionality entails that those affected by the problems and policies are meaningfully engaged with and in developing responses to and effective solutions for the policies areas discussed. So despite this, and probably not surprising to anybody who knows anything about disability, disability is often ignored in intersectional analysis. We see the requisite nods to disability in the list of identities to be considered, or ability or ableism in the list of power relationships, but we don't really see much substantive engagement with disability by intersectionality scholars. Part of the reason for that may be because people with disabilities are generally invisible in societies around the world. As well, most societies have taken for granted foundations that are ableist. As well, there's a history in the development of intersectionality of ignoring disability. As well, for policymakers, there's a gender-first approach. So these provide only a partial understanding, we think, of the gap. There's also real knowledge to be gained from how disability itself is created, sustained, and constructed. So the history and context of disability helps us understand this gap. For example, we know that disability and race have been conflated by policymakers and service providers in some global northern countries. For example, in the United States, in special education, Blackness is equated with disability. We also know that many Indigenous languages and cultures have no concept of disability, and that colonialism has systematically disabled many Indigenous peoples, which has created a reluctance to embrace disability identities. Both create challenges for including and addressing disability in an intersectional analysis. So, what did we do? Well, our intersectional policy analysis argues that we can do more transformative change when we identify how policies themselves constitute, replicate, and maintain unequal power relationships. So it shifts policies from being seen as a neutral tool to understanding that policies themselves are part of existing social relationships. So how did we do this? Well, we began by understanding and identifying what we mean by diverse people with disabilities. The groups that we identified were identified through brainstorming with our community partners and through an initial review of the community literature. In gathering data and analyzing what we found, we went beyond traditional disability data sources to understand the complexity of experiences of people with disabilities. For example, since the disability data related to COVID experiences didn't address LGBTQ2 spirited folks, we drew on a survey from EGAL Canada to supplement our findings. In doing this, we found that there was more about disability than we expected. From our recruitment of participants through the collaborative data analysis sessions that we undertook, and while writing the final report, we held ourselves and each other accountable to illustrating the complexity of experiences. Finally, in developing our report and sharing our findings with policymakers and the media, we made sure to articulate and demonstrate the impacts on diverse people with disabilities. So for each of the 19 thematic areas, and drawing on all of our research, we identified key impacts related to the theme and which people with disabilities were most affected. Valerie. We've lost you, Valerie. There you are.
Sorry, that was awkward, but I couldn't find a new button. All right. So now we'll talk a little bit about two themes, income and access to care, and highlight the differences among diverse people with disabilities, what was done and what was good practices. So in terms of income, we saw major income gaps between people with disabilities and those without disabilities. They were widened by government pandemic measures. This was especially true for Indigenous people with disabilities, women with disabilities, and people with lower levels of education. People with disabilities, especially young people, women, and those with lower levels of education were more likely to experience job loss and face greater barriers to employment than people without disability. We also saw that everyday supplies and services cost more for people with disabilities. It makes it hard for them to meet their needs, especially those on low income, those living with children or living alone. People with disabilities face additional barriers to supplies and services because of public transit interruptions, for example, and limits to in-person shopping. Government funding measures often left out people with disabilities, or they came too late to be helpful. Many people with disabilities, including older adults, racialized people, Indigenous people, families, and people living with low income, had limited access to information and services, often because they could not afford or did not have access to computers or the internet. So next slide. What have been the COVID-related policy responses by Canadian governments? So we're all familiar with the Canada Emergency Response Benefit, or CERB, that was at $2,000 a month. That is nearly double what some people with disabilities receive on income assistance. That was a stark reminder of the income gap that people with disabilities experience. Other emergency funding required people with disability to be registered for the disability tax credit, which meant that many people were not eligible. Many people with disabilities did not have access to CERB. Some provinces, such as British Columbia and to some extent Ontario, provided increased monthly assistance to people receiving disability assistance. Ontarians, however, reported that they had difficulty accessing information about this additional support, and many reported not having access to it at all. Very inconsistent. But there was also inconsistencies across provinces related to the coordination of CERB and disability assistance. Some provinces, such as Ontario, treated CERB as employment income and clawed back some of the disability assistance, or ODSP, that people received. Next slide. What were some good practices that could improve access to income in future crises? So government should extend income supports to all people with disabilities, including those who may not officially registered or eligible, and regardless of their work status. There's also need to be a better coordination between income assistance programs offered by federal and provincial government. Federal income support programs need clearly defined goals and parameters to prevent inconsistency across provinces. They should also be fully exempt from income and disability assistance benefits. Income support programs need to recognize disability-related costs, and access to meal and food security programs need to be protected and expanded during the pandemic and emergencies. Let's now talk about access to care quickly. So the impacts that we saw first was that people with disabilities, especially those who rely on personal support workers or live in congregate settings, have a greater risk of contracting COVID-19. I want to bring attention to a quote that a participant shared with us. It's a woman living in a congregate setting. She says, quote, "The thing I really want to emphasize is the lack of support from the agency. Not only lack of support, but what I perceive to be gaslighting. When I initially freaked out about the care agency's lack of pandemic plan and that I was looking for answers, they told me that I was fear-mongering and like I was crazy. Do you know what a pandemic is?" End quote. Other impacts related to care was that the pandemic responses reduced access to primary and routine care and have reduced the quality of care received. We also know that COVID-19 triage policies raise concerns about whether people with disabilities would be treated fairly in emergency situations. The other thing that we noted is that using phone and online platforms for healthcare appointments may increase access for some people with disabilities, but it has created more barriers to accessing care for others, such as women with disabilities, individuals with intellectual disabilities, people with mental health disabilities, people who are deaf or hard of hearing, and those who have no or unstable access to internet and other communication technologies. And finally, social distancing and other lockdown procedures led to poorer mental health for people with disabilities due to increased isolation and reduced access to mental health services. And next slides, good practices. We note the Public Health Agency of Canada released a number of guidelines related to COVID-19 and people with disabilities. Many illustrate an intersectional and human rights approach. So the Public Health Agency of Canada developed a public health ethics framework for use by policymakers and public health professionals that incorporated expert feedback from members of the disability community. It provided specific guidance for long-term care facilities, shelters for people experiencing homelessness, correctional facilities, and included specific consideration for congregate settings. But these guidelines were really hard to find on the website, and we're not sure if they were really used. The good practices is that people with disabilities must be included and valued in the design and implementation of preparedness and response plans, and preventing discrimination based in disability is especially important when ventilator rationing measures and medical triagings are discussed.
Great, thanks. So we want to conclude by just identifying 5 key messages we'd like to leave you with. Oh, and of course, as soon as I do this, there they are. We'd like to recognize the importance of doing cross-movement intersectional research that starts from the lived experiences of peoples. We intentionally sought out diversity through our recruitment, letting participants define themselves and let us know how they wanted to be represented in the study. That way, we moved away from assuming that disability was the key dimension in their identification of their identity, or that they identified as disabled at all. We believe this leads to a richer understanding of people's identities and lives. As well, as I mentioned earlier, it's important to look outside disability research and work with other movements like the LGBTQ movement. This cross-movement work allows us also to work in policy advocacy together and creates new relationships and new alternatives for change. We believe that second message is that disability leaders like Gabriel and Sarah and many others and organizations offer important insights for ensuring disability justice. They're essential to the policy development and analysis and need to be at the decision-making table as full participants, recognizing that they also should be getting financial support to participate at these tables. As Valerie said, the federal and BC governments created these disability advisory groups. Disability leaders are often innovators, introducing and acting upon ideas for disability justice well before they become mainstream. And when we bring them to the table in discussions, including about emergency planning and preparedness, we will have better practices and more inclusive solutions. Thirdly, we believe that accessibility and inclusion standards are essential. We say in the report, if long-term care homes were required to meet accessibility and inclusion standards and had the funding to do so, there'd be fewer people with disabilities in congregate living settings who died during COVID. If we included intersectional disability data in our mortality, health, education, violence, employment, housing, and other statistics, we would have a better basis from which to develop policies and respond to emergencies. And we will achieve more and better disability justice when these standards measure and evaluate the extent to which the dignity and human rights of those most excluded and marginalized in societies are proactively protected. We think fourth, a national disability benefit is important. The federal government announced it, but hasn't acted on it yet. They're still in discussions. A measure that includes a wide proportion of people with disabilities, including sponsored immigrants and those with mental illness, is essential to addressing the gaping holes that we talked about. One thing is certain, that the disproportionately negative impacts of COVID-19 on diverse people with disabilities requires concrete and comprehensive steps by government. Finally, our fifth message that we want to leave you with is that in this project, we worked with our partners through community engaged research. We were committed from the beginning to do the research together and through knowledge mobilization. So we've done presentations together, we've been on the media together, but we've also seen that our report is an opportunity for advocacy organizations to use the research as leverage for their advocacy work. So we use, as researchers, our privilege and credibility to support and strengthen advocacy voices. This is our role, we see, as those who are being paid to be intellectuals or academics. And we look forward to your comments and questions to help challenge us and clarify our work. Thank you.
Thank you very much for this very comprehensive presentation, which really captures the essence of your report. It was very hard to do in such a short time, but I think you did a very good job in giving a very accurate picture of the things that people can look up in more detail in your report. So can I invite Gabrielle Peters now to give a comment, and she also has a slide presentation.
Good afternoon to those of you for whom it is afternoon. It's still good morning on the West Coast, though. Thank you for inviting me to make a few comments today. I'd like to begin by acknowledging that I am speaking to you today from the unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations. I have a slide presentation I prepared to try to keep me on track and succinct, while hopefully packing in some additional points for consideration. My presentation is focused on BC. I have done this for several reasons. We are often either ignored or quite misrepresented in national discussions about disability, the pandemic, or anything. We have less established disability activism and more established neoliberalism in disability. There seems to be a very strange belief that West Coast is left coast, when in fact you might be surprised by the similarities in policy between John Horgan and Doug Ford. I am going to describe what is on the slides when appropriate, for accessibility reasons. Slide 1. Already left behind and pushed aside, we became invisibilized, disabled people and COVID-19 in BC. As a disabled poor person, none of what some describe as gaps was revealed to me or any other disabled poor person as a result of the pandemic. Those of us living in poverty have known and spoken about these issues for a very long time. I also take issue with the word gap, or at least in how it's being used. I would like to suggest we have gaps of coverage in an otherwise large expanse of nothing. Slide 2. Bonnie Henry and Our Pandemic in BC with a photo of a woman sweeping under the carpet, which is a pretty daisy growing out of it. Early on, the country did us a disservice by uncritically praising Drive Bonnie Henry and her handling of the pandemic. A number of factors, not the least of which was the sheer luck of the timing of a March break in BC, meant that at the outset BC appeared to have a better pandemic. Something Bonnie Henry called Our Pandemic. A new book deal was made, a shoe designer designed a Bonnie Henry shoe, a book tour was launched, she shared how she considers herself an empath, media was booked, awards were given. And by the way, people in BC were dying. There is a lot that I can say about BC politics and culture and media environment, but suffice it to say, the outside adoration didn't encourage greater scrutiny, willingness to engage with concerns and criticisms, or provide appropriate transparency. Rather, the opposite. Slide 3, hashtag, say the word. The word is disabled. When the pandemic hit, it was apparent to disabled people in BC that we needed to become visible and on government and media radar more than ever. We know from experience that non-disabled people were going to react badly, and I think most of us knew early on we needed to take immediate measures and not wait for direction. But we also knew government support was going to be vital to our survival, and we needed them to understand our specific needs. Typically, we are left out of discussions on equity, diversity, and even inclusion, a word with origins in the disability community. The pandemic proved to be more of the same, not that equity was discussed much in BC, period. Slide 4. Please disaggregate data. Please give us data. Every marginalized person in BC. The Black community, disabled people, and others lobbied for disaggregated data and transparency. We knew that our communities were being hit, but we lacked data and evidence. Disaggregated data is a long-standing battle and need in BC. Slide 5. The pandemic was another health crisis. Safe supply is a disability justice issue. I am from BC, and I therefore can't speak about any topic related to disability justice without mentioning safe supply and the massive number of deaths we have happening, growing in number every single day, as a result of a toxicity in the supply. I don't know a single person of any class or race in BC who has not lost a family member, friend, colleague, neighbor, or all of the above to the toxicity crisis. Nearly 9,000 people in my province have died as a result of overdose resulting from an unregulated supply. 7 more will die today. The downtown east side is the open wound of colonialism. It is the consequence of the war on drugs, the failure of Western medicine to be guided by its own oath, the violence of poverty, the unfulfilling of the institutionalization that included community care, and other crimes of capitalism. When I ask DTES activists what percentage of residents are disabled, they tell me 100%. Slide 6. The downtown east side of Vancouver faced some particular problems. Again, the fight for data was essential, not only to plan for and keep people safe, but in order to know if certain policies were having unintended consequences because they were not designed with the other health crisis in mind. Staff at shelters, supportive housing, and various other services have become ill, as well as the clients and tenants. Supportive housing instituted no visitor rules for COVID, which is considered to have contributed to the spike in overdose deaths, as people were now using alone. And there were those with money seeking to avoid being vaccinated themselves, but wanting the paperwork that said they were. So they paid homeless people to take their ID and get vaccinated for them. Many of these people were vaccinated multiple times. There are, of course, no studies on what possible health impacts this might have on them. Slide 7. I promise I'm getting to the pandemic issues, but first it's also important to note climate change and extreme weather and fires resulting from it were also happening simultaneously, and again, impacting similar populations to disproportionate degree. This slide shows clippings from some of last summer's climate change-related emergencies, including flooding, wildfires, and the heat dome that killed almost 600 people in 1 week. The combination of these crises and the decades of preceding neoliberal policies meant there was insufficient paramedics and ambulances. People in Canada's third largest city literally died waiting for help to arrive, in some cases 8, 10, and 12 hours from the time they called. Slide 8. BC pandemic, drug poisoning, and climate deaths are linked. All of these crises shouldn't need to be dealt with at once, because they all stem from the same source. Journalist versus Wells writes, between November 1, 2020 and October 31, 2021, at least 4,327 people in British Columbia died from just 3 causes, 1,893 from COVID-19, at least 595 from extreme heat linked to climate change, and at least 1,839 from toxic drugs. The number of drug toxicity deaths in October 2021 has not yet been publicly released. As CBC journalist Justin McElroy points out, this represents almost 1 in 1,000 of BC's adult population. Each of these deaths marks a systemic failure to keep people safe. Slide 9. Okay, let's talk about the supply chain. Early in the pandemic, people were stockpiling, or in some cases hoarding, or worse, clearing shelves in order to resell it on Amazon at ridiculous prices. These people had access to credit cards. Poor people, on the other hand, live check to check. In 5-week months, we often have gaps in our food supply due to gaps in our income. Delivery services, which many of us rely on regularly at non-pandemic times, suddenly became overwhelmed and unavailable. I spent almost a week fighting online with Save on Foods to add a button allowing disabled people priority booking, as they only had one for seniors and essential workers. Only for seniors was a common theme in many pandemic policies. Disabled people were completely ignored. At the same time, food costs were going up, people's incomes were going down. It's important to recognize the stream of income that is not typically discussed or recorded by those tracking these things. Binning, the collecting of cans and bottles, is an essential source of income for many. Others typically pick for books and clothing they can resell on the street corner. Less people out meant less bottles and cans. I want to mention something about PPE. I live in a social housing building with 500 other disabled and/or elderly people. Many have home care aides. These home care aides even have their own lounge. They go from apartment to apartment. Some work some shifts in long-term care homes in the area which had outbreaks. There was no PPE supplied to them, and there still isn't proper masks supplied. I also suspect they have not had proper training, since I see them with their nose exposed or their mask dangling. Remember food banks? Those temporary solutions introduced back in the 1980s. They were running out of food and continue to demand in-person pickup with identification. I do a lot of work on the issue of accessible housing and have been fighting for years to have en-suite laundry included in units. Slide 9. Ask us anything. During this time, disabled people were writing columns, blogs, on social media offering their insights to non-disabled people. We know how to adapt and adjust to health crisis, and we were a completely under-tapped resource and wealth of knowledge. Slide 10. Housing. There is so much to say about housing and so little time. People with no housing faced the push to move indoors due to public complaints from those who had housing. In turn, shelters were less safe in terms of the spread of COVID. When I interviewed one man for an article in the Heat Dome, 3 of his friends had died in their apartments. The ones who had survived had all slept outside even if they had housing. So the question of whose safety matters and who is put at risk is an important one. As a wheelchair user, I think every single day about how I would feel safe being outside but not getting to outside. I have been self-isolating since the beginning of the pandemic. I have no balcony and the windows are largely inaccessible to me. There is poor ventilation, and if I didn't have social media, I would not know there is a pandemic. I don't have a television, and there has been, I think, 2 pieces of information from the nonprofit. The first came almost a year into the pandemic. None of it has been translated into the languages many of my neighbors speak. And, of course, in addition to nursing homes, group homes, hospitals, disabled people are in prisons. Slide 12. Safety concerns persist as COVID-19 outbreak at Maple Ridge Jail spreads. Prisoners who were COVID negative were replaced with prisoners who were COVID positive. The same policy is in place at hospitals. It makes no sense. The care and tracking inside prisons is of grave concern. Slide 13. Here is where I shamelessly plug the paper I co-authored with Dr. Halio Whitman, Cassandra Vujovic Dunn, Amin Nawatani, Sharmaz Mishra. Nothing about us without us. Canadian vaccine decision-making must involve disabled people. We are short of time, so I will just supply the link to Trudeau for those who wish to read it and study this chart. Across Canada, national and provincial COVID-19 vaccine prioritization guidance and strategies have failed to appropriately include people with disabilities. Slide 14. Is two-tier healthcare growing in BC? This article discusses a physician moving to TELUS Health and telling his patients they would be required to pay an annual fee of $4,600 if they wished to remain in his care. After years of patients asking for virtual appointments as an option, they finally happened as a result of the pandemic, and they are now being privatized and thus become inaccessible to many. Most seriously, they undermine the very nature of Canadian healthcare. Add this to doctor shortages. It is estimated that 700,000 people in BC don't have their own doctor. Slide 15. Personal observations. The already major difference between disabled people I knew with their own vehicles and nice homes and those who are poor grew huge. There's virtually no similarity between the pandemic, my friend who is a wheelchair user with her own vehicle and home, and I have experienced. Disabled people who were marginalized feel far more so. The ableism we experienced is not new, but the concentration of it was. Many disabled people feel more hopeless, and many openly discuss MAID as the only service available to them. Eugenics underlies all these policies and attitudes. People are moving on, back to their beloved normal. They are leaving us behind and they don't care. Slide 16. I changed my mind about basic income. I have always been concerned about the neoliberal opening it creates and its failure to consider the additional expenses disabled people face. But I do not support this national Canadian disability benefit because I know the gatekeeping around it will leave some disabled people behind. We need a guaranteed livable income that is across the board, while keeping programs like the medical equipment supply program in place and expanding that to include air conditioners and air purifiers. We need to change the building codes and change how we design homes. We need to protect human life. Thank you.
Thank you, Gabrielle. On that very sobering note, I would like to invite Sarah. to provide further comments.
Hi, everyone. That was amazing. I don't know how I'm going to follow up all that content. My name's Sarah. I live in Hamilton, Ontario, which is a working class city that has the highest density of disabled people in all of Ontario. So I'm the executive director of an organization called the Disability Justice Network of Ontario. It's a youth-led organization that's led by Black and racialized young women mostly, who are interested in building out theories of change and challenging institutions that exist to create spaces that are truly and fully accessible, and to build a world where people with disabilities are just free to be. And I think that what I can offer to this conversation is an on-the-ground look at some of the issues that have been talked about today by Valerie, by Deborah, and by Gabrielle. When the pandemic first hit, like many people, my friends and I all panicked, and the first thing that came to mind was, what are folks who are immunocompromised going to do in order to access food and be safe during this time? So we worked together to create a food delivery system where we were able to feed over 7,000 families over the course of the pandemic by collecting donations, packaging food kits, and delivering that straight to people's doors in a no contact way, at a time period where food services weren't delivering and food shelters had shut down. So we were doing this work, and we quickly realized that many disabled people, because of LRT development in our community, were being evicted along the LRT line, or their buildings were being rent evicted. I don't know if folks know this, but in Hamilton, the rent rate has gone up 96% in the last 6 or 7 years, according to Liliane Farhan, the former UN Rapporteur on Housing. Hamilton is now one of the top 3 most expensive places to live in all of Canada. And couple that with the fact that we have some of the lowest income rates and the highest rates of people with disabilities in our province, it's really egregious. So what you had was almost entire buildings of people living on social assistance, on fixed incomes, being rent evicted out of their units, and then actually having to set up tents and live in parks in our communities. And so while we were focused on packaging food kits and delivering that to folks who weren't able to make it to grocery stores, there was also the added issue of that not being enough, and people also falling through the cracks of no longer having anywhere to live. On top of it being almost impossible to find an affordable place to live in our community, it's even harder to find an accessible place to live. And there are only 2 accessible women's shelters in our community, which left a lot of people in the dark. And so we began to try to deliver food kits into encampments. And we found ourselves in the middle of one of the biggest encampment evictions in Ontario, 80 tents on Ferguson Boulevard, 80 tents completely taken out by police and city officials. And it was mostly disabled people, and it was mostly people who were living with addictions, and it was mostly people who were banned from shelters, which was another thing that was occurring during this pandemic. Many people who were being labeled as disruptive, which is super ableist in terms of language, were being banned from accessing shelters until 2025. And so we had a situation where people with disabilities were being barred from coming into shelters because of the ways their bodies function, right? You're told, come into the shelter, you're not allowed to use, you're not allowed to exhibit symptoms of your mental health concern. And if you do, that's considered disruptive. Super ableist language that's not really protected or prevented, under the Accessibility for Ontarians with Disabilities Act. And the reason that all of these gaps continue to occur and impact disabled people the most, especially on the ground here, is because legislation that does exist, which is few and far between, like the Accessibility for Ontarians with Disabilities Act, tends to leave, like, it focuses on consumerism. It focuses on, like, I have a right to access a store and expend my economic purchasing power and buy whatever I want from the store and be treated with respect as a consumer. But it doesn't actually force services like our city services to put forward a human rights lens on top of AODA. And so shelters can say, yeah, you're being disruptive, even though you're disabled, you deserve to live in the street. Or the province can enter public-private property agreement with our city that forces disabled people to be evicted from where they were living without actual proper supports in terms of moving or finding somewhere else to go. People with disabilities are dehumanized with and without existing legislation, and we saw that even more during the pandemic. Right now in our community in Hamilton, we have, I think, we have one of the worst rates of the impacts of the Omicron, Delta, I'm not so good at the new terms, viruses in our community. And so we worked really quickly over the course of a few weeks during the second lockdown to force public health into prioritizing disabled people and Black and racialized people in our communities in terms of the vaccine rollout, because at that time, the government hadn't really done so in an accessible way. Eventually, we kind of went rogue and we took matters into our own hands, put out a Google form, asked people to register for the vaccine who were racialized and disabled, and forced the city of Hamilton to look at the data, say like, these are all the people who would want vaccines and you're not providing it for them. And so we became the first city in all of Ontario to have a municipality to prioritize those populations outside of what Ford decided to do at that time. But it took a lot of pushing for them to see that, you know, disabled people were continuing to be left out of these conversations. We were also able to get people to go out into encampments and provide vaccines, and also to provide vaccines in parks over the course of the pandemic. I'm rambling, but I'm showing the ways in which our existing legislation and the existing decisions have, like you all have articulated, left gaps that have continued to harm and often lead to the death of disabled people in our communities, and how disabled people have had to step up and sort of fight to meet those gaps over and over and over again. And the solution to this that has already been articulated would be for disabled people to be at the table when we're talking about public health crisis responses in advance, right? We shouldn't have to be pushing for what we know to be true and what resources that we need. People who are disabled, who are on the front lines, should already be at those tables and approached for solutions in times of crisis and before times of crisis even occur, because the pandemic wasn't really a surprise. Researchers have been saying for years that we were due for a pandemic eventually, and yet people with disabilities were continuously let down. We also saw triage protocols pop up in almost every province that said that disabled people would receive a second tier version of our healthcare. So if you're disabled and you're seen as having a comorbidity, whatever that means in today's day and age, you could be refused healthcare. During this time of the pandemic, we also saw legislation be expanded, like medical assistance in dying, which said that if you are disabled, but you're not terminally ill, all of a sudden you can now access assisted suicide. And that has never existed in Canada before. But because we're disabled and we're seen as having suffering more than other Canadians, we were being given access to fast track or access to assisted suicide in a way that was unprecedented and happened over the course of 18 months while people were struggling to survive during the pandemic. And that legislation was expanded to allow room for those of us with invisible disabilities too, and mental health concerns who do struggle with suicidal ideation to also access assisted suicide. So over and over and over again, we're being shown by people in positions of power that it's much easier for the government to allow disabled people their right to die over their right to live. It's much more financially feasible for the government to, evict us, leave us out into the street, force us into accepting legislated poverty in terms of social assistance rates, and also to allow room for disabled people to just choose to die rather than be supported throughout life. And Gabrielle can definitely talk more about this, because I got involved with MAID when she hit me up and said, this is happening at Senate and there are no racialized people that are signed up to delegate. All of this is covered in the report, and I just wanted to give a very correct rundown in terms of what that means for those of us here in Hamilton, and I hope that helps.
Thank you very much, Sarah. So these were four fantastic, very divergent presentations coming from different perspectives. Certainly the last two ones are an incredible reality check for many, I think, who may be on the seminar. Some of this may be new, or they may not have had a sense of the magnitude of the concerns that persons with disability face. So let's open it up for questions. Those who follow this seminar, have been at this seminar before, know that some students take this seminar as a course, and I prioritize them for the first set of questions. I invite the others, because this is a webinar for security reasons and organizational reasons. We can't have people physically asking a question from outside the class and the panelists, but you can actually type in questions and I will see them, and I can certainly come to these questions after I invited some of our students to ask a question. So without further ado, let me ask Alison Alison Zhao to ask her question. And if I may suggest to focus maybe on the third question, and I'll explain to you afterwards why.
So was it mine?
Alison Zhao, oh yeah, your third question was I would suggest.
Oh, okay. So given how our restrictions are being relaxed, are some of the COVID-related concerns will they continue to escalate, or is there already some effective action already underway?
Okay. Deborah or Valerie, you can start.
Valerie, do you want me to go first?
Yes, please.
Okay. I think that there's some, let me back up for a bit. Gabriel gave a link, at least to some of us, to a piece of work that she did about vaccinations. And I know that in the Canadian Journal of Public Health, there is going to be published soon an article on the situation in Manitoba and people with disabilities and vaccines. What both of those pieces and others show is that what we're seeing is the increase in protection for many people, but not necessarily accessible vaccination methods, as well as there are people, including lots of people with disabilities, for whom the vaccines are either really challenging to get because of their conditions and their situations, or inaccessible. So the step that many people are taking around vaccines isn't necessarily one that's been inclusive for lots of people with disabilities. So then the removing of restrictions like masking, distance, vaccine passports, all of those sorts of things, bring us back to a situation early in the pandemic where people with disabilities are the ones who may be having the first impact of the high numbers getting COVID without the protections in place or without sufficient supports in place. So I'm worried. I'm worried that there'll be just this increase in numbers of COVID among people, among my community of people with disabilities, but also real hard choices that people have to make because they don't feel safe. So I have some immune compromised stuff in my body, and I can tell you that I'm really scared to go into the classroom. I'm scared to go into public settings because I'm not sure how I'm going to do it. And that's amplified many times for others with way more significant concerns than I have. So the answer is yeah, it's going to continue to be a problem and could perhaps be even worse.
I'll just
My view.
add, thank you, Deborah. I'll just add like two little notes. Also, we see that while we relieve some of these restrictions, people in prisons, they're the same type of isolation measures. When there's a case, everyone has to be in solitary confinement, for example, it's still going on. So even if cases are going up and we think it's like milder, well, it continues to affect people living in prisons and jails disproportionately, because they continue to be in solitary confinement due to COVID cases. And the other thing is that I found at the personal level, just like Deborah was sharing, even at our university, at the University of Guelph, the people that are exempt of either coming on campus or can have restrictions do not include a lot of the conditions that people have. So for example, I'm 6 months pregnant and I don't count as someone who might be more at risk of COVID-19. So it's been very difficult for some people to navigate, to be considered more vulnerable. So I just wanted to add that. Thank you.
Very good. So I'll go to Alice. Actually, Alice, if you can focus on your third question, that would be great.
Hi. I think I've forgotten which third question I had, Professor. Sorry.
So this was about best practices. Suggestions in the paper seem very reasonable to me as an idealistic law student. So I'm wondering why in the world it took a global pandemic exacerbating many of the cracks in the system. The discussion about the difference between 2,000 monthly payment for the CRB and the 1,200 monthly limit on ODSP was mind-boggling in a very bad way. Could you explain more about why policies for disabled people have had such a disparate impact? Is this a lack of representation in policymaking, a general cluelessness, or something else? What can be done to not only raise awareness, but also encourage implementation, ongoing funding and management for these ameliorative programs? Okay, so I asked Alice question. I'll start. Okay, so I'll start with either Deborah or, and then I'll go to Gabrielle.
Why don't you start with Gabrielle, and because she's prepared a question, an answer, and then we can follow up from her.
Okay, very good.
I'm probably going to give you a very different answer to the others. I don't believe that the fundamental issue here is one of ignorance. Nobody is unaware that you can't live in a major Canadian city on $1,200 a month, especially not as a disabled person, since we have additional expenses some of us refer to as crib tax. And to keep in mind that to qualify for disability benefits, a physician has to determine you are permanently unable to work, so this level of poverty is forever. You can't just wait until your income goes up to get a new pair of shoes, because it never does go up. To understand why we live in poverty, I recommend reading a book called Capitalism and Disability by Marta Russell. Russell wrote, "Disability oppression has less to do with prejudicial attitudes than an accountant's calculation of the present cost of production versus the potential benefits to the future rate of exploitation. We are, in essence, the surplus humanity in the system of surplus value." I have a short video which lays this out well, but I don't think we have time for me to show it right now. The significant thing is that awareness will not change this. It's a matter of political will, and short of ending capitalism, that political will is only going to happen as a result of widespread organizing and activism. The problems around this are a whole other topic, but there is a reason that anti-capitalist politic is the third principle of disability justice. What can be done is mobilizing and organizing.
Okay, Valerie or Deborah, do you want to add anything, or we go to the next question?
I think Gabrielle's given a fabulous answer, and I agree with her on you need to understand the links between ableism and capitalism and colonialism, I would add. And that if you think that it's just about, getting a new best friend who is disabled, that's not going to change the system. The system has been created to make so-called productive workers that look like me, right? Who are white, look able-bodied, those sorts of things. It's not there to support folks whose bodies work differently, or who may be Black or brown, or maybe Indigenous, and have had to live with long experiences with the effects of colonization. And that's my fatigue coming up, my disability coming up, as you hear me stutter. So
I'll go to Dina Nixeris.
Thank you. My question was, do you think part of the solution to this disproportionate impact people with disabilities are facing due to the pandemic could be something like our society having an increased expectation of private companies and actors to better serve and assist these individuals with disabilities?
Yes, I will invite Valerie or Deborah.
I'll just, I think, build on what Gabrielle and Deborah have shared. I was surprised when I saw that question because we associate private companies with capitalism flourishing, right? Capitalism roaring. And we know that from a disability justice standpoint, when capitalism does well, ableism does very well as well, and colonialism and racism. So my first response is like, we should not have to rely on private companies to have access to our services. Indeed, we have to, we really have to be careful of private companies making profits out of people with disabilities who actually live in, a big proportion live in poverty. But at the same time, it could be linked to government support to companies. Maybe companies should have some sort of quota or some sort of certification or some sort of responsibilities, right? Like maybe disability access to disability services and accommodation should be a corporate social responsibilities where they need to be met in order to get government support. I don't have a very well articulated answer to this question, but I see major tensions between like encouraging capitalism, which in turn leads to more ableism and other structures of oppression, but also this is the world we live in. So what can we do to make sure that people with disabilities have access to what they need?
Thank you very much. I will take a question now from James Butler.
Ew. All the presentations today have been amazing. Is it all right if I change my question? I was thinking, because different disabilities create different like access needs, and those needs kind of like come into conflict, like who like Gabrielle was talking about with like televised with telehealth medicine, like how that kind of shifts stuff. How do you decide when you're looking at an issue when to break it down into more like specific conditions or functional limitations versus like treating with disability broadly, and like when do you actually have the ability to like make that choice? Thank you.
Trudeau, can I answer that one?
Yeah, for sure.
Okay, it's Deborah. So thanks, James, for this. I think that one of the things we want people to think about is how people who are not disabled have built-in accommodations in their world already, and they don't even have to ask for it. The example I often give are lights. Sighted people in a dark room can assume there's going to be a light switch there to turn on the lights. So I'll often in public talks say, okay, I'm going to turn off the lights. I want you to write something. And most sighted people can't do it. But my blind friends have no problem writing in darkness, because darkness is the same as everything else for them. So as able-bodied people, you expect, they expect certain accommodations in place. That's the way ableism works, right? You assume that's normal, that's natural. Well, what we in the disability community are asking for is inclusive and accessibility that's built into the environment, so that you don't get to the point of having to make choices about who gets what. So that we call it inclusive design. So it means, rather that, and curb cuts are always the classic example, right? You get curb cuts on a road or in a sidewalk so folks in a wheelchair can use it, but it has a much broader use. It works for people who have strollers, baby strollers. It works for people who use roller blades. It works for skateboarders, right? Like, it is a much broader use, and yet it is intended to create opportunities for people with different ways of moving through space, to move through space without barriers. So that's the goal, is to create a society that has been designed to include the majority of ways of being and living through the world, so that accommodations, which are individual adjustments that are made, are really limited, and so that people are included without even having to be asked, or without even having to ask for the inclusion.
Very good. Safa Warsi. Safa, you're muted. I'll read her question. Okay, so the report mentioned a multitude of disadvantages that people with disabilities face, in addition to not being consulted on measures, given that protective measures put in place during the pandemic are being clawed back. How is that uniquely affecting those with disabilities now? What can be done to ensure that this vulnerable community continues to be protected? Some suggestions have been made. Do you want to add anything to what has already been said about some of these issues?
Can I challenge the language a bit? I'm going to just, I appreciate the question, but I also want to say this vulnerable community, it is a community where vulnerability is being created. It is not necessarily because we are people with disabilities that we are inherently vulnerable. So I like to think of vulnerability being created in situations. So we can recreate situations to reduce vulnerability of everybody. And so to reduce the vulnerability of everybody who lives in congregate settings, or reduce the vulnerability of everybody who faces COVID. Oh, that's the whole world, right? We need to think differently rather than, and we need to recognize how additional and intensified vulnerability is created for particular groups like people with disabilities. And we've given some examples in response to another question, but I don't know if anybody else has a response.
Okay, so I'll go to Safa Bajwa.
Hi, thank you for your presentation. I had a question sort of regarding funding specifically, and I was curious about what sorts of ways we can help the government ensure that funding is being sort of fairly and appropriately delegated to guardians, for example, who are taking care of individuals with disabilities, and in some cases, very severe, maybe cognitive or physical disabilities, in which case they may be even adult dependents and may need a guardian for the rest of their life. While also taking into account everyone's unique situation. So for example, I'm thinking of maybe a single parent of 3 children, including one such child who has significant disabilities. How would we ensure that the government is funding them in comparison to a family, for example, where there's dual income, high earning family members? Like, how do we ensure that the funding is being appropriately delegated in those cases?
Deborah or Valerie?
Valerie, can I take a first crack at this and you can add? So you've raised 2 really important points. One is the cost of living with disabilities, and the other is the goal of policymakers, which is to make sure that there are that the costs of providing services don't overwhelm the money that's coming in. And so let me just first talk about the costs of living with disabilities. At this point in time, across Canada, there are very few places where you receive funding to recognize the costs that you have living with disabilities. There are some places where you can get some, but you get retroactive stuff through the tax system if you happen to have earned income. But it's really, that would be for me a first policy step, to create a refundable tax credit rather than what we have now, which is a non-refundable tax credit. So a refundable tax credit that recognized the range of costs associated, and with a lot of flexibility built in, that recognize the costs of living with disabilities. And then there's also the income question, which is, I think, could also be addressed through an income program that was, I'm of the view that a basic income program for all people with disabilities is the best way forward, but not everybody's in agreement on that. So for me, there are a couple of different pieces, but that getting society to recognize that it is not the responsibility of the individual who lives with disabilities to pay the extra costs of living in an ableist society, right? That it's society's responsibility to do that, and therefore we move it through the tax system.
Thank you.
Sorry, I was muted. Valerie, did you want to add anything? No,
No, I
I'll
have
go
nothing
to
to add. Thank you.
Okay, so we'll take a question from the floor, which is the webinar. I have a question that I will read from Asiya Hussain, who writes, for the researchers at the University of Guelph, was the data you had access to and analyzed disaggregated specifically on disabled persons with disabilities, or persons with disabilities who are also racialized, Indigenous, Black, women, LGBTQ, visible hijabi, etc. If not, what was your experience in trying to account for these gaps?
I can try to explain a little bit, and Deborah can elaborate more. No, a lot of the data is not disaggregated to a large extent, like you presented, especially since during the pandemic, it was crowdsourced data that we had access to by Statistics Canada, which meant that people, it's not representative of the population of people with disabilities. People have to opt in to do that survey. So it's a certain type of people that will do it. So people that may be more invisible or marginalized, or don't have access to a computer, or don't identify as being disabled because of colonialism, and so may not have participated. So this is definitely a gap that we recognize when we source data. So one of the things that we try to do is to connect with community leaders that represent these more invisible communities. And again, there are gaps. There are gaps in our research. For example, we had a very low representation of Indigenous people with disabilities. And at that time, we didn't have the same connections to really understand more the experiences of Indigenous people with disabilities. Through our research projects now, we are building relationships. It takes time. We are building trust in order to have that type of data, but more in a qualitative way. Hope that answers your question. Deborah, do you want to add anything?
No, great answer.
Okay, I have a question from Marie Fiedler. As I read through the report, I was struck by how the exclusion of people with disabilities and the erasure of their reality seems to have only gotten worse from when this report was written. As we move out of restrictions and the provincial government seems intent to, quote, get back to normal, unquote, what organizing and action do you think might be effective in helping people with disabilities and vulnerable people from the ongoing threat of COVID-19? So I'll invite Gabrielle to answer.
Erasure is almost unnecessary since they did such an effective job at acting as though we don't exist. I am deeply concerned with the level of hopelessness among disabled people in BC. Our frustrations throughout the pandemic have been quite different. Whereas people complain of mask fatigue, meaning they are tired of wearing a mask, we are tired of hearing people complain about wearing a mask and tired of people refusing to wear a mask when our health and well-being depend on them doing so. We are feeling very discouraged right now. You showing you care enough to fight for those protections means a great deal to us.
Deborah, Valerie, you want to add anything? Maybe if I can ask a question, because it's an issue that some of us have been involved with also, and that has been mentioned particularly by Sarah in her presentation, also alluded to by Gabrielle. So the issue of medical assistance in dying and the expansion of the law in the midst of the pandemic, but arguably certainly the disability rights organizations and advocates would argue with insufficient attention to the concerns that people had. I mean, what do you have any comments about, even from your interviews, what you feel has been going wrong there? So there are cases coming to the fore now and on social media about persons with disabilities asking for medical assistance and dying. But there are concerns also, I've seen that on social media also by Gabrielle, concerns that the social media may contribute even creating a kind of a buzz around that as an option instead of addressing the needs for people to live. Did you encounter in your research that as a significant concern? Do you have any personal thoughts about this? Any ideas, anything that you can comment on?
I'd love to start here, if that's okay. I have lots of thoughts about this. Yes, this came up often in our research. It came up in our interviews and focus groups. It came up in the literature we reviewed. And what people should know is that what the statistics tell us is that people with disabilities, racialized people with disabilities, Indigenous people with disabilities, all experience higher levels of mental health concerns and decreased access to services in the context of the pandemic. So what we kept hearing was that's what's leading to this sense of hopelessness and isolation, as well as this retrenchment in what Gabriel has called invisibilization, what we've called consistently excluded, that sort of reinforcement of systemic exclusion has made many people with disabilities feel hopeless. And when they can't access supports to help them get through this, but they're encouraged in some cases to think about the option of medical assistance in dying, they feel like their lives are not being valued. What worries me was so yes, I think that changing the parameters of the legislation during a pandemic was a pretty clear indication to me of the direction this government sees as important, rather than providing significant supports to people with disabilities. So, right, like really pushing to get medical assistance in dying during a pandemic when people are feeling increasingly vulnerable and isolated and without supports, what was really unwise. But I think it says something about what the government wants. I also just want you to know, and I don't think I'm letting things out of the bag, this is the area of our report where we were asked to give the most substantive referencing to every sentence that we wrote about medical assistance in dying from the government. In general, this was a report. They were happy to receive it, but this particular section on medical assistance in dying, we were called to provide extraordinary referencing and support for every sentence we wrote, which again tells me that the government understands that this is a real issue and they may have acted inappropriately on it. So
I just want to quickly add, and I know Gabrielle should speak to this, but to the people with disabilities that we talked to, it was a slap in the face to have this legislation go through. They see that the government is providing $2,000 a month through CERB to people without disabilities, and they're surviving on $800, $900, $1,000 when they live in Toronto. Now they see this legislation pass really, really quickly during a pandemic. That is not coincidence. It really meant for them that their lives are not valued. Some participants say we are second-class citizens. So just wanted to add that.
Yeah, so if I may add to your comment about the need to provide extensive referencing, it's interesting because the government started to review in delay just before the elections, the 5-year practice of medical assistance in dying, and they only had actually one session where 2 experts testified, including me. And I revealed some of the cases that I know are real, but they're not court cases because it's very difficult to go in that context to court. This is an area where, first of all, people with persons with disabilities don't easily go to court because it's expensive, but also when people are dead, they're no longer there to go to court anyway. So I revealed some of the problematic cases and urged the parliamentarians at the committee to investigate and to really look at this as part of the 5-year review, which in my view, they should have done before changing the law. And so I said that as well. And I was basically shut down. So they were referring to this as anecdotal. And I raised issues of ableism and they never asked me questions. So what happens in political hearings like that is you ask the person who you like to say what you want to hear. So I was rarely given an opportunity to actually expand on what I was saying. I gave a 5-minute presentation. Anyway, gives you an idea indeed that the government is nervous about this. And I think they will be have to be confronted with further news about this, about the reality of this, of the concern.
I think there's a really important bit of research to do about COVID-related deaths, MAID-related deaths, and excess deaths in 2021 and then again in 2022. So we have the data now that we could be doing more research around COVID deaths, MAID deaths, and excess deaths. And I think we need to demonstrate, as researchers, I think we have a responsibility to do this.
Yeah, we should talk about that. Yeah. So I see that Gabrielle wanted to say something also about long-term care. And I know some students also, and we have to conclude very soon, but I want to give an opportunity to Gabrielle maybe to say something in relation also to questions that have been raised about the long-term care. Gabrielle.
I would like to say something about long-term care. I have had to fight being placed in long-term care, and as my condition continues to change my body, I will have to face that fight again. Let me tell you some things about how that has impacted me. I have turned down home care even though I am permitted home care. Why? Because if I am using it now, then what happens when my needs change? The next step again will be long-term care. It inhibits me in seeking support and makes me even more hesitant than I already am about seeking medical care. The reason why I was originally going to be forced into long-term care is because I was, at the time, unable to transfer on my own. The housing for disabled poor people in Vancouver is so small there is no room for the kind of equipment I would require. The reason I have been told I will need to move into long-term care in the future is because I will need a breathing assist, the kind that can be mounted to the back of a wheelchair. The conversation with the doctor happened before May passed, and the doctor suggested that he empathized with my desire not to move into a nursing home and encouraged me to instead go home and not seek help as I suffocate to death. This was not the first time I was urged to die by someone in healthcare. Nursing homes, private or public, are like prisons, private or public. Certainly one is worse, but neither is a place anyone wants to be. If you had a choice tomorrow between living the rest of your life in a nursing home or dying, I imagine it would not be a simple choice.
So on that, again, another very sobering note from Gabrielle about the reality of people with disabilities face in the Canadian context. I would invite maybe Deborah and Valerie to make some last comment. Yeah, because we are running out of time. So is there anything you want to say, even with respect to the remaining questions that were put in the Q&A in response to Gabrielle's comment? Deborah or Valerie, no?
Sorry, I'm just trying to read what was in the Q&A. I think what I'd like to say is how what we're trying to share today in each of the stories and with the data, the research that we've done is to say that this is a lens, a way of looking at things that you shouldn't avert your eyes on. This is one to look at, I mean, to use cited language, to really focus your gaze on this. And I'd encourage each of you to think about ways that you as students, as people in the community, can work with disabled people to support their advocacy and be aware of it, whether it's in a family relationship or in your broader community. How can you support and provide support for disabled people to live the best life that they can in the context, including in COVID?
Valerie?
Again, I think through the questions about our concerns about going back to our beloved normal, a question about elections, it's about amplifying the work of disability activists, disability leaders. They are innovators. They know how to deal with problems. They know the needs of people, of diverse people with disabilities. It's about amplifying their voice and having them at the table. Thank you.
So on that note, we hope that this seminar will contribute in a small way to that awareness and listening to voices of disabled people. So we will post this seminar online, and it will also have subscriptions. I'm very sorry, actually, as myself, a hearing disabled person, that we didn't have a proper transcription while the seminar was ongoing, but we will post that so that it's accessible to all on YouTube via the calendar at the law faculty, the calendar of the seminar series. This will be available, and I'll send it around as well. So on that note, please join me virtually in thanking our presenters, our commentators, for a very eye-opening, very touching presentations and very enriching discussion. And the listeners and to the students, thank you again for your very warm questions and very interesting questions. Thank you.